Hi, my name is Helen and I'm an infection control nurse with Sheffield Teaching Hospitals. Welcome to our video designed to provide you with an overview of what's required if your area has been closed because a COVID-19 outbreak has been declared. You may already have been informed of this and not be sure what to do next. So we hope that alongside our written support pack for outbreak wards, which infection control will direct you to, this video will enhance and clarify your understanding. And remember, you're not alone. Amongst other support teams, the infection control team and virology are available to provide additional input as required. So what is an outbreak ward? Why has an outbreak been declared? And what does this mean in practice? A COVID-19 outbreak is declared when 2 or more healthcare associated cases in either staff or patients have arisen within a clinical area in the past 14 days. Meaning cases that are either probably or definitely acquired from that area. Once declared, the area is then closed to further admissions, other than to patients who are COVID resolved or on wards which provide critical admission pathways. Any COVID positive patients must be isolated via transfer to a COVID cohort ward or placement in a side room. Likewise, COVID-exposed patients must also be isolated by cohorting those from the same exposure together or transferring them into side rooms. Other patient transfers off the outbreak ward should generally cease. Visitors are no longer allowed, unless in exceptional circumstances. All efforts must be made to minimise staff movements both onto and off the ward and, if possible, allocate dedicated staffing groups to care for the COVID positive, COVID exposed and non-COVID patients separately. And finally, you will now be asked to implement enhanced infection prevention and control measures along with regular screening for COVID. You'll be provided with a support pack and the IPC team will help you set up and manage your outbreak ward. As you can see, there are a number of special considerations that need to be addressed on an outbreak ward, which fall into the categories of PPE and scrubs, testing, admission restrictions, zoning, signage, cleaning and waste management, and the promotion of positive protective behaviours with the help of an IPC champion. We ask that wherever possible, all staff wear scrubs, which can be obtained from laundry services as detailed in our support pack. Staff must change into scrubs on entering the ward and generally remove them before leaving. Exceptions to having to put on scrubs are for short stay visiting staff, such as delivery staff or porters, and staff attending urgent situations who do not need to change into scrubs but who must wear the required PPE. Exceptions to having to remove scrubs before leaving the ward are staff going directly to another COVID outbreak or COVID cohort ward and staff leaving for work-related visits, such as when accompanying a patient on a visit or going to pharmacy or labs. Again, although scrubs may be left on in these situations, PPE appropriate to the visit must be worn. And remember that when wearing scrubs, normal dress code policy still applies and includes, for example, having hair tied back, being bare below elbows and having natural nails. To enable the safe use of scrubs, it is important to consider changing and storage facilities. Clean scrubs need storing in a clean area. Then, separate to this, you'll need a changing area where staff can change into their scrubs, store their possessions, perform hand hygiene and don a mask and visor before exiting to the ward. At the end of their shift, staff will then change out of their scrubs in here, dispose of them into closable infectious linen skips and perform hand hygiene before leaving. Remember, the IPC team can advise what's best for the facilities available to you. It is important that all staff wear a fluid-resistant surgical mask and visor at all times in all clinical areas of an outbreak ward, including when not involved in direct patient interactions, as pictured here. These can be used sessionally and should be removed before breaks and before leaving the ward, unless accompanying a patient. You will need a PPE station outside the ward entrance so that all people coming onto the ward can perform hand hygiene, then don a mask and visor before entering. Here we have a member of staff ready for patient interactions. In addition to the mask and visor worn sessionally, they are now also wearing a long-sleeved apron and gloves. which are changed between each patient contact along with hand hygiene. PPE supplies can be obtained from procurement as detailed in our support pack. And don't forget, when considering PPE on your ward, it is important to encourage patients to also wear fluid-resistant surgical masks as much as they will tolerate, even when in their own bed spaces. To help reduce the spread of COVID infection, it is important that we regularly test everyone to detect any unsuspected sources of infection. As always, the guidance for anyone suspected of possible COVID symptoms is to be screened via a PCR COVID swab at the earliest opportunity, but we'll also be routinely screening those not suspected of symptoms as follows. For all patients on the ward, we'll ask that they are screened with a PCR swab on the day the ward is closed, unless at an unreasonable time of day, in which case the next morning. This closure day is known as day 1, and further screens are then required on days 3, 6 and 10, then possibly every 5 days until the outbreak has resolved. The IPC team will use e-whiteboard to remind you when screens are due, as well as contacting the ward daily and producing the outbreak report, which also details screening dates. Remember that in addition to this, patients will need screening if symptomatic, as well as on days 1, 3 and 6 of their admission as per normal trust policy. Please don't screen patients that are within 90 days of their first positive result, as these will be either deemed active or resolved and thus managed differently to other patients. Staff testing will be via a combination of lateral flow device or PCR tests for asymptomatic staff. Exact requirements will be communicated to you by the IPC team or virology at the time, in accordance with the current guidelines. It is important that all staff working on the ward are participating in this, including all multidisciplinary and visiting staff. Ward managers or matrons should monitor that this is actually being done, and details of how to obtain swab packs for PCR screens can be found in our support pack. Remember, your outbreak ward is essentially now closed. This means from day 1 there must be no new admissions of patients unless they are between 14 and 90 days on from a first positive COVID result and deemed clinically resolved. The only exception may be when a decision has been taken to admit further COVID positive patients for cohorting with those already on the ward as part of the outbreak, in which case infection control or virology will inform you. When thinking about admission restrictions, think about staff too. Try to maintain a core staff base working on the ward, which not only limits staff movements off the ward, but also minimises the flow of traffic onto it. For non-ward-based staff, for example, could a restricted number of nominated people provide cover for your ward? And of course, please ensure that any essential staff entering are aware of the enhanced IPC measures and screening in place and are actively participating in both. Zoning is the physical division of the ward into red, amber and green zones with the use of coloured floor tape in order to help ensure that staff wear appropriate PPE in each area. Estates can be contacted to carry out zoning as detailed in our support pack. As you can see, the red or dirty zones are the patient areas, including their bed spaces and bathrooms, where staff should wear full outbreak ward level 2 droplet PPE, as shown earlier. The amber zones, where gloves and aprons should be doffed and hand hygiene performed before entering a green zone, will be at the exits of bays and side rooms. The green zone on an outbreak ward is not considered clean, as there remains a risk of unidentified staff infection. Thus, in such areas as the nurses' station and doctors' rooms, staff must still wear masks and visors, perform regular hand hygiene, practice social distancing, and ensure enhanced cleaning to help combat spread. To help keep everyone informed, it is important that you place signage outside and within your ward, which must be appropriate for an outbreak area. Here are some examples of signs that should be displayed, and the full list should include the large red stop banner, which must be placed outside the entrance and can be obtained from the equipment library, a PPE station sign directing all those entering to perform hand hygiene and don a mask and visor, a no visiting poster outside the entrance, Level 2 droplet donning and doffing posters specific to outbreak wards, which account for masks and visors being worn sessionally. Coronavirus hand hygiene posters, including in patient areas. And the use of crosses and ticks to ensure socially distant seating. It stands to reason that on an outbreak ward, you'll need to ensure optimal standards of cleaning and waste management to reduce the levels of contamination and associated risks of infection spread. Enhanced cleaning should include hourly cleaning of all high-touch surfaces and shared equipment, such as phones, keypads and handles, or preferably between each person's use. This should be carried out using Tristal, Fuse or Jet, with the only exception being the use of Clinell universal wipes for non-patient equipment only. To facilitate this, ensure the environment is clutter-free with correct storage off the floor of all items. A cleaning checklist will help ensure that hourly cleaning is being completed, and if additional support is required, the details of both domestic and waste services can be found in our support pack. When thinking about waste, all patient areas must be deemed as potential COVID areas, and thus all bays should have their offensive tiger-striped waste bins replaced with infectious orange ones. Likewise, all linen should be deemed potentially infectious and thus be disposed of as such. In addition, please ensure that waste bins and linen skips are not overfilled and have lids or can be otherwise closed. The measures covered thus far need to continue until your outbreak is declared over. But when will this be, and what happens then? The outbreak is declared over when there has been a period of at least 10 days with no further positive cases. This is when the ward is deemed safe to reopen. But before this occurs, the whole ward must undergo a thorough amber clean and complete curtain change as the minimum requirement. Please plan for a red HPV clean wherever possible, however, as this is our gold standard for ensuring the safest environment for reopening back up to new admissions. In the last few slides, we address measures aimed at supporting the smooth operation of your outbreak ward and looking after its staff. We need to promote positive protective behaviours amongst staff and patients that help protect ourselves and others by reducing the risks of transmission. These include wearing our PPE, maintaining social distancing, performing hand hygiene and cleaning, and it is crucial that we try to embed into everyone's psyche a sense of shared responsibility and concern for each other's safety so that these are seen as everyone's responsibility. Senior staff can promote these by providing visible leadership and support, conducting outbreak huddles and debriefs to promote well-being and effective communication, and nominating an IPC champion for every shift. This IPC champion should act as a role model influencing the practice of others, be a source of information and support, and monitor that required practices are being followed using the action card daily checklist from our resource pack. They may be any staff member from any discipline, and the role must be viewed as the shared responsibility of all ward staff, who will thus all need to be aware of required guidelines and all be involved in ultimately looking after each other and our patients. It's important to recognise the potential impact of being on an outbreak ward upon our patients and staff. Staff may suffer from fatigue, anxiety, or cognitive overload as information constantly evolves, which in turn can affect performance and communication. The Trust has various pages detailing numerous services aimed at supporting the physical and mental well-being of its staff, and these are signposted in our support pack. Allow for the fact that you or your colleagues may be affected in different ways. Remember, you deserve looking after, and ensure necessary support is made accessible and encouraged. This is the end of our video, and I'd like to thank you for listening to the information contained, which can also be found in the accompanying support pack. Please remember you are not alone, and that as well as your own managers, you can contact the IPC team, virology, your PPE champion, the duty matrons, and many other support teams within the Trust whose contact details are contained in our pack. Please remember that together we are all part of one big team whose aim is to assist in the management of each outbreak in the safest manner for the benefit of all. Thank you.